Literally a water bottle and a box of gum is holding this all together. But postpartum, after vaginal birth, what to expect. This is for my nurses who want to be postpartum nurses. This is for my moms who are like, what's going to happen to me postpartum? Your girl's got somewhat of an idea of what goes on, at least for the next, couple days after postpartum. Because I've been a postpartum nurse for 7 months now. Yay! And I absolutely love it. So let's get down to it. Postpartum, once you push that baby out, if you had a tear, you will have the doctor repair it while you're holding baby during that golden hour. You will, have all the feelings and all of that, but from the moment you give birth, your 2-hour recovery begins. And what happens during the 2-hour recovery? So basically the 2-hour recovery is making sure that your vital signs are stable and your bleeding is stable before you come over to maternity / postpartum, whatever you call it, after you have the baby. So I haven't trained in vaginal recovery yet, but the nurse will be going, so I'm trying to do the movement like this to your uterus, pressing down on it every 15 minutes for the next 2 hours. Yikes. I know. That's the last thing you want to happen, but it's very important we do that because a firm uterus is a uterus that isn't bleeding. And then if it is firm and it's still bleeding, that's a way for us to know, okay, something else is going on. Is your tear bleeding? Is the lower part of your uterus bleeding? Soft and causing bleeding? Because what causes bleeding is your uterus and your placenta are, together like this. And when your placenta delivers, it leaves, blood vessels, open spots for those blood vessels attached to your uterus. So the uterus contracts down and firms up and shunts off those open, spots in your uterus. So that's what stops the blood from coming out, or the heavy blood loss, I should say, from happening. And then, that's why we got to check that it's nice and firm. Fundus. Fundus is basically another word for your uterus. It's a fun word, right? So that's what's going to happen for the next 2 hours. They're also going to be checking baby every 15 to 30 minutes, depending on if baby's skin to skin or in the warmer. Everything I say also is my hospital policy. Other hospitals may be different, but this is what I know from what happens at my hospital, okay? Okay. Then, once you're okay, and as long as everything's good, you get to come over to postpartum / maternity, where myself or another lovely nurse will take you, and for the next 3 hours, we're going to check your uterus every hour. Same reason. Making sure it's nice and firm, okay? Making sure you're not overly bleeding. For a vaginal delivery, blood loss, a combined estimated blood loss, which is basically what the doctor just looks at. They just eyeball the blood and say, oh, it's this much. And a combined estimated blood loss and quantitative blood loss, which is the pads. They take the pads you're bleeding onto, the chucks, anything you bled onto, and we're measuring it. If those two numbers are combined, 500 or more, then we're a little bit more concerned. We'll actually do blood work, a DIC panel, which basically looks at all your clotting factors, and we'll right away see, okay, how much, clotting factors have you lost, because that's a little bit more than what we're used to for vaginal delivery. So just so you know about that. And then that IV that you have, moms always ask me, when is this coming out? So 12 hours from the moment you delivered. So if you delivered at midnight, at noon the next day, they'll draw your blood. As long as your hemoglobin looks good, it's, above, I would say 8. I would be comfortable anything above 8 taking that IV out. So there's another question answered. But yeah, once you come over to postpartum, we're checking your uterus every hour for the next 3 hours. And then after that, you don't have to have your uterus checked again for 8 hours. So we check the uterus every 8 hours. We check vital signs every 8 hours for moms who have a vaginal birth. Different story with baby. For the first 24 hours, your baby's going to be checked every 4 hours. And then after that, once they hit a 24-hour mark, they can be checked every 8 hours, because by then they've transitioned. They should be breathing good. They should be kind of acclimating to life outside the womb. Their temperature should be, sustaining really well, all that good stuff. The main things we're looking for in those first 24 hours is the baby's respiratory system. How is that going? Are they grunting? Are they gurgly? Are they spitting up a lot? Are they breathing really fast, which is called tachypnea? Are they having retractions, which basically means when they breathe in, does their skin suck in where their sternum or their ribs are? Those are things we're looking at for, do they turn blue or purple? If your baby turns blue or purple, please, please, please sit them up, pat them firmly. Don't be afraid. I mean, don't do it to where their neck is like, whipping back and forth, but give them a good firm pat. And if you have that bulb, you should have that bulb syringe in the crib where you could grab it, take it, squeeze it, put it in the baby's mouth and suction. Try and get anything they're probably choking on spit or formula. So suction that out if your baby turns blue. Another thing we're looking for in the first 24 hours is that their temperature is good. Newborns have this funny little thing where, they can't regulate their temperature as well. So keep a hat on them, keep 2 blankets on them, or a nice big fluffy blanket, or hat, shirt, and skin to skin, safe skin to skin, to keep them nice and warm. At my hospital, we do a bath within 6 hours of birth. I know other hospitals don't even bathe the babies. Every hospital is different. I kind of like it because you get like the junk out of their hair and stuff, but you can totally refuse a bath. Don't ever feel like, your baby has to get a bath when the nurse says it's time to get a bath. You can refuse a bath. So there's my take on that. And then after those 24 hours, every 8 hours, you'll be checked. Okay. So you get a little bit more rest and a little bit more peace and calm. Other things we do at 24 hours for baby, we check their bilirubin level on their skin. If that's high, then we'll do a bilirubin serum blood work test to see if that's high and if they're at risk for jaundice. Of course, if they look yellow, we'll test it a lot earlier. They'll get a PKU test, which means they'll do a heel stick, and they have this sheet of paper where they have to fill up these 6 circles with blood. So it does take a little bit longer. That is to test for certain metabolic conditions that we can't see visually or really tell if the baby has just by looking at them, things like celiac disease or certain blood conditions. So they'll get that. Usually they'll get a if they need a TSB, which is the bilirubin jaundice test, blood test. We just do it at the same time as the BKU, so they don't have to get poked twice. So if your baby's getting PKU and they haven't done a jaundice test, ask them. Say, hey, shouldn't my baby be tested for jaundice, and can we draw it right now? These are things I want to give you tips and tricks so that you can advocate for yourself as a patient, or as a nurse to advocate for your patients. So that's what I like to do. Other things, medications you'll most likely get. Motrin for cramping and afterbirth pains or that tear. You can also, if your cramping is so severe, you can also take a Norco. Don't be afraid to take a Norco. I've had moms who've had vaginal births, especially one after twins. She needed it so bad. Just know that it might make you dizzy, drowsy, and constipated. So if you feel dizzy or drowsy, ask the nurse for help before getting into the bathroom. Also, if you got an epidural, do not get up to go to the bathroom by yourself the first time. Get help. And if your legs are still buckling and feel numb, still get help, okay? Okay, we don't want you falling. Speaking of constipation caused by Norco and other things, you're just going to be constipated for the first couple days postpartum, whether you have a vaginal or a cesarean birth. So take your Colace, take your stool softener. It's that little orange pill we give you at the hospital. It works wonders. It doesn't make you go poop. It just makes going poop easier. Look at me talking about poop. You can tell I'm a nurse. So if you don't get sent home with stool softeners, please just, when you pick up your Motrin or whatever the doctor prescribes you, or if the OB comes in and they haven't prescribed you Colace, just ask them, hey, I need a stool softener when I go home. It'll work wonders for you. Believe me, you're going to want it. Sometimes doctors prescribe Pepsin, which is like an antacid, because sometimes moms get heartburn or indigestion after having the baby. So you might get that. And then if you had a tear, you will get Dermaplast spray and witch hazel pads. The witch hazel pads you'll line your pad with. And the dermaplast spray you'll spray on every time you use the bathroom, and it will work wonders for that tear. And it'll just cool the area, numb it, make it nice and soothing, treatment, kind of help with the burning and the itching, okay? And if you just can't get comfortable with your tears, like you can't sit, you're just so uncomfortable, there is something called the donut seat. It's about this big. It looks like an inner tube. Ask your nurse for that. It blows up, you sit on it, and it relieves the pressure. This also helps if you have hemorrhoids. It just helps with pressure coming down on that area, and it's sensitive after you push a baby out. That whole area is sensitive. So ask for a donut seat if you're just not getting any relief with the Motrin or the dermaplast spray or any of that. Nothing's helping, or you just can't get comfortable, okay? I'm trying to think of going through my mind things that we do. Another thing to expect postpartum, hemorrhoids. You pushed out a baby and you were pushing hard and you didn't realize that so hemorrhoid cream, be aware. There's options. There's pain relieving options for you. And after a vaginal birth, you can shower, you can eat whatever you want. You just push the baby out. That's all that happened. And, you're able to do those things. I have moms all the time. When can I shower? When can I eat? I'm like, honey, you can eat and shower whenever you want. Different story with the C-section, but if you had a vaginal birth, you are good to go. If you have any other questions about postpartum, or if there's anything about the hospital experience that I forgot, mamas or nurses, comment down below. Let me know. Any postpartum tricks, tips, anything like that. This is kind of like a quick overview about what to expect after a vaginal birth. So, happy to educate, happy to tell you guys. If I remember anything, I will mention it in the description. So, next up will be C-section birth. So, keep an eye out for that. All right, you guys. See you next time. Bye.